The Model Hospital helps you compare your productivity with other trusts and identify opportunities to improve. The opportunities on the homepage and on the opportunities page show some of your trust's biggest potential productivity gains. We use different approaches to give you the most appropriate figures for each type of opportunity. For clinical specialties, we compare your trust with a peer group of other similar trusts. The higher value would be achieved by matching the better trusts in your peer group, and the lower value by matching the middle or median trust. Your opportunity for each clinical service line is the difference in productivity between your trust and your peers, multiplied by the amount of activity you carry out. Let's take a trust whose cost per weighted activity unit, or WOW, for breast surgery is £3,600. This is the average the trust spends for each unit of breast surgery activity. The median trust spends £3,400 per WOW, but a trust at the boundary of the best quartile only spends £3,200. So there's a potential efficiency gain of between £200 and £400 per unit compared to their peers. If the trust carries out 2,000 units of breast surgery activity each year, they have an opportunity of between £400,000 and £800,000. Trusts aren't expected to reduce spending by this amount. You could also improve productivity by increasing output. We've shown how many more patients you could treat or the additional staff you could employ if you kept your costs the same but improved productivity. Featured and supporting metrics help you understand where your productivity diverges most. For instance, featured metrics might show opportunities to improve in workforce. Supporting metrics identify specific staff groups with higher than average costs. Each opportunity page explains how it's been calculated. Most opportunities use the recommended peers list, our best estimate of 10 similar trusts based on a number of factors, but we use other peer groups where appropriate. You'll also find links to relevant guidance, case studies and contact details. To find out about productivity opportunities for your trust, visit model.nhs.uk.